therapists, we can spend a lot of time and many sessions with clients who come into our offices seeking help for things like anxiety, depression, ADHD, and hour after hour, we help them peel that onion and go after those symptoms in efforts to help them feel better. What if I told you that sometimes the fastest and most effective way to help your clients with mental health symptoms is actually not by seeking to treat those disorders specifically, but rather focusing on some foundational aspects of health, including sleep, and that by treating sleep first, you can actually get further faster than a lot of our more traditional psychotherapy interventions. Yes, it's true. I learned this not too long ago at a fascinating clinical training conducted at my practice, Growing Self, by a renowned researcher into sleep psychology and a behavioral medicine specialist. And she's here with us today on Love, Happiness, and Success for Therapists to share her wisdom, her perspective, and her recommendations for how you can incorporate this very important competency into your practice. Now, I am thrilled to introduce to you our colleague, Dr. Michelle Okun. Thank you for doing this with me.
Thank you. My pleasure to be here.
And so just to begin, would you like to tell our listeners just a little bit about your background and what it is that you do so they understand?
Yeah, so I am a research health psychologist. I have been focusing on the relationship between sleep health and its association with longevity, with good functioning, good immune system functioning, endocrine functioning. So it's really my passion to try to find the relationships and then disseminate and talk about how important sleep is to one's overall health, psychological and physiological health.
Yeah, absolutely. I'm so happy that you're here with us today. And I have to share. So we first connected, you actually came into our practice, Growing Self, and did a beautiful continuing education event for the clinicians on my team, talking about the importance of sleep health and the impact on so many of these other variables that I think many therapists aren't trained, frankly, to think about and just like are not connecting these dots. And I learned so much from your training. I was like, more clinicians really need to be understanding this and thinking about this in their clinical practice, because otherwise, well-meaning people, like self-included, can spend a lot of time and energy trying to help our clients and treating things like depression, anxiety, even ADHD, thinking that we're doing the right thing, but missing the proverbial elephant in the room when we're not also considering the impact of these really important physiological pieces, sleep being one of the most foundational. And what I would love for you to talk just a little bit about, and I know that this is a complex subject, and you are a trainer of therapists. You do multi-hour training events where you go into this in a very deep and detailed way. But at a high level, can you talk about how a sleep issue or sleep disorder can many times be the root cause or at least one major component of this cascading impact that begins to affect our clients, not just in terms of how tired they feel, but like cognitively, emotionally, in terms of their psychological processes, and just shed some light on this for us.
Absolutely. The behavior of sleep is connected to everything in our body, from our fight or flight response, so our stress reactivity, our ability to cope with stressful situations. When we don't get enough sleep at night, we suffer mood wise the next day. We're more irritable, we could be more snappy. Our ability to take things in, slow down, take a deep breath, and then properly react is often diminished. Our health and our ability to fight off infection is diminished when we're not getting enough sleep. when the symptoms of depression and anxiety are heightened tremendously when we're not getting enough sleep.
Yeah.
And one of the most interesting things that I find that some various colleagues of mine have done is to look at people who are depressed and or anxious.
Hmm.
As you know, disrupted sleep or insomnia often is a primary symptom that gets reported with people who are depressed or anxious. And what is interesting is if you treat the sleep problem as its own entity, right, rather than
Hmm.
just a symptom of the mood disorder, and you actually treat it, deal with it appropriately and effectively using usually CBTI or cognitive behavioral treatment for insomnia, not only will you improve that sleep issue, but you will often see a mitigation in the depressive symptomatology as well as the anxiety without even changing that treatment.
Yeah.
So we can see significant improvements when we realize that the behavior of sleep, and if it's not doing well,
Hmm.
if you're not sleeping well, if you're not paying enough attention to it, the extensive ramifications that it can have on a person's mental and physical functioning.
See, I think that that is just so interesting. And honestly, like one of my significant concerns is that we therapists are vulnerable to talking with clients who are coming in with mood disorders and they're not sleeping well. And of course, they're not. It is one of the symptoms. And so we get hyper focused on the treatment of the mood disorder itself. And what you're saying is that by actually refocusing and seeking to treat the foundational physiological health components that are fueling frequently mood symptoms, you can get a lot further a lot faster than if you're just
Indeed.
trying to intervene with the psychiatric symptoms by themselves. And so, why is this? I mean, you're saying that suboptimal sleep is a fueling factor, honestly, of some of these mental health issues. And help us understand, like, what does that make sense when you look at it from a health perspective?
So, again, the behavior of
Hmm.
sleep ranks up there with drinking water and eating food. Okay. It is a necessity.
Yeah.
We must do it on a daily basis.
Hmm.
And so that's often where try to start off when I'm talking about sleep is, it is up there as far as
Yeah.
importance. It's not what many people believe is, oh, it's a voluntary thing. I'll do it after everything else is done.
Hmm.
I will put it at the bottom of my list. It really needs to become prioritized because everything you do, every minute, your bodily function from the genetic material to healing within each cell, your metabolism, everything is based on and driven by your sleep. Because when you are sleeping at night, there's people think, oh, I'm dead, I'm in a coma, nothing's really happening during the sleep process, and that actually is very far from the truth. So
Mm.
when we are sleeping, the brain is regenerating, we are repairing, we are restocking the shelves, so to speak, with energy for the next day, basically cleaning out the trash and building up the supplies needed. And so it is a really important time of the day that tend to be that nocturnal period for most humans, in which we just again restock the shelves so that we have all that we need in order to function appropriately the next day. And when we don't sleep well or we don't get a sufficient amount of sleep or good restorative sleep, the shelves don't get stocked fully, and so you're driving on a quarter tank of gas that you need to go a long way during that day, so you're going to
Hmm.
run on fumes eventually. Just you don't have the energy to complete all the tasks, so you may have memory fog or cognitive issues. You just can't remember as well. We know that sleep is critical to not only consolidating new memory, but it's essential for retrieval of memory and information.
Mm-hmm.
So when that sleep is not solid and sufficient, kinks in the system or breakages or blockages in the neural pathways take place, and we won't be able to actually pull all the information we need. So you're just kind of running on a quarter of a tank when you really need and want to be running on a full tank.
Yeah. Yeah, absolutely. And there are all of these, not just cognitive processes, but metabolic processes. And so, what does your research or research you're familiar with reveal about what starts to happen to people over time when they're really not getting either as much sleep as they need or not the level, the quality of sleep that they need? Because from what I understand, there are different types of sleep or stages of sleep that have different functions in terms of our physiological processes that can impact us. And what do therapists need to know about what can be happening in the bodies and then by extension brains of our clients that they might start to see in clinical practice and think, oh, that is a psychiatric syndrome, when in fact it's just a manifestation of a sleep
Sleep.
disorder. Yeah.
Yeah, there's a lot to potentially look at. Everything is connected by the degree of sleep quality, the depth of sleep. There's various parameters. Most people tend to look at sleep duration, like how long did you sleep?
Right.
And that's one good proxy. But if you're in bed or you're sleeping for 8 hours, but you're only really getting a few hours of good quality sleep, physiologically quality sleep, that may not be sufficient. And so you just may be tossing and turning and you're not getting the repair. You're not getting the replenishment of the necessary cellular supplies that are going to be needed for the next day. So again, you start each day on a very empty tank, and it becomes difficult to just maneuver the easiest, most simplest tasks when you don't get enough sleep.
Got it. Okay. And so it just begins to touch all of these different systems. And so I guess can you talk a little bit more about your understanding of how this then starts to balance? And I'd love to hear you talk through just your current understanding of the way that this leads people to start thinking differently or perceiving things differently, even to the point where they can look like mood disorders or cognitive processing disorders.
And that is actually what happens. It's not a one day you're not sleeping, the next day you have dementia or depression.
Thank goodness.
But it
Yeah.
is over time. So chronically being sleep deprived or having poor quality of
Mm.
sleep, the way I like to described again, I'm a visual person, so I like to give
Yeah.
people visuals.
Hmm.
Is if you look at an iceberg or a glacier and you're
Yeah.
taking a spoon and you're chipping away at it and you look
Right.
at it day after day, you'll see no difference.
Hmm.
But if you have that done and then you come back like a year later, you'll see a big gaping hole. So there's
Yeah.
a change that has happened. And each day that you're not getting the sufficient amount of sleep that you need, and that does differ from person to person. The
Hmm.
average adult needs between 7 and 9 hours. Okay.
Okay.
That's a pretty big range. Once we start seeing chronic sleep of less than 6 hours, that is usually a huge risk factor for a whole bunch of different diseases:
Mm.
cardiovascular disease, metabolic disease,
Hmm.
neurodegenerative disease. The little by little that you may not see takes its toll over time. Again,
Hmm.
the body doesn't get cleansed out and the trash doesn't get emptied out as well in the brain
Hmm.
or the body. The stress response is constantly on,
Yeah.
right? It's just, it's you almost feel like there's a humming in your body, that it's just
Hmm.
the electrical capacity, everything's on. You never get the chance to really calm down and
Yeah.
repair. When
Yeah.
you're not in that, if you're not calming down and that sympathetic tone is always on, if you're always stressed, you're always worried, you're always going, the body cannot heal and repair.
Right. And
And
not
so your
getting
ability to
enough
function
sleep
becomes impaired.
stimulates that stress response in and of
Yep.
itself.
Yeah. So it perpetuates it.
Hmm.
The worse your sleep is, the worse your stress response is, more cortisol, the worse your sleep will be. The
Hmm.
more cortisol, the worse your sleep will be. And then your ability to handle stress, your
Mm.
patience, your tolerance, that threshold, something comes your way. We've all seen people, we've all been in that situation where something happens and you immediately react
Hmm.
without really thinking about it and understanding why you're being so reactive. And often it's because you're just not getting enough
Yeah.
sleep.
Yeah. And so you're saying this isn't like a all or nothing fast thing, that you're not going to fall into dementia or depression if you miss a few, go through a stressful chapter and you're not sleeping well for a few days. You might feel tired. But what you're saying is over long periods of time, it's this sleep deprivation and the chronic stress response that goes with it that actually begins to change the way that people perceive what is happening to them, that events are perceived as more stressful, or that there are these cognitive shift in that filter that can then lead people to feel worse mentally and emotionally, become less resilient. And then that begins to turn into a self-perpetuating cycle that then further interferes with the ability to sleep well, which then exacerbates the whole thing. It's like this downward spiral, you say.
It is.
Wow.
It's a multi-layered downward spiral.
Yeah. And we were chatting earlier, and you brought up some other, I thought, fascinating information about the impact of this sleep deprivation and stress response on the microbiome and that brain vagus nerve gut relationship that we now know is so crucially important to our mental and emotional functioning. Like your gut, what is it, producing 80 to 90% of the serotonin in your body?
Yeah.
I mean, like,
yeah.
It's significant.
And a large amount of dopamine too. Yeah.
How does the sleep cycle disruption or chronic stress start to impact your microbiome to the degree that it can change the way we think and feel?
Yeah, so that's really such a fascinating area
I'm so
of research.
interested.
So stress, and again, let's just call it what it is. It's the cortisol that gets
Yeah.
secreted. Cortisol binds um, pretty much ubiquitously in the body to varying degrees. There's receptors for it all over. It has a lot of receptors in the gut and in the intestinal tract. And when there is too much cortisol, this leads to what we could call an inflammatory state, or this leaky gut, in which toxins that should be on their way out through the large intestine and to be excreted out don't all make it. And some of them get leaked into the periphery and inside the body, and that can change and cause toxic issues, changes in pH balance, and whatnot. Sleep in and of itself, again, which is can be a consequence of stress, but it also lead to more stress and the expression of cortisol. This cortisol, again, in the brain changes the receptors in your reward system, in the amygdala, in the hippocampus. So a lot of areas in the brain that respond or receive cortisol, that can change your food choices when you eat, the seeking of highly palatable, big dopamine push type foods, serotonin type foods, carbs,
The
cheese,
donuts.
sugar, donuts, whatever everyone has their
Right.
thing. And so that then changes the composition in the microbiome of the bacteria. So the foods
Interesting.
you eat and the stress, the cortisol itself can dysregulate and lead to too much bad bacteria. Then the food choices and the dysregulation of sleep can also contribute to that. So it's very multifunctional and
Sure.
multifactorial.
Yeah.
But again, if you just think about it, if you decrease the stress that you're experiencing, if you focus on good sleep, if you focus on exercise, if you focus on good nutrition, all those things tend to balance each other out, especially in relation to the microbiome, keeping the good and bad bacteria in balance in a very kind of, copacetic manner.
Yeah. Yeah. And that sleep and just that foundational biological process is just one of the cornerstones of keeping all of that in balance. It's such an interesting topic. I feel like this research into the health psychology component and the impact of that on mental health is really the vanguard of our field personally. So I can't wait to hear more from you about this. But for therapists listening, and just myself included, I know that in my clinical training, even getting to know a client and preliminary interviews, we're assessing and trying to understand what's going on in clinical histories and trauma histories, and are they symptomatic for these different things, and certainly was trained to screen for things like drug and alcohol use and significant life events, but not really ever taught how to think about some of these health factors, including sleep, except for, are they ding, ding, ding? Oh, yep, that's one of the symptoms of an anxiety disorder or mood disorder. And so can you take us into what you consider to be the best clinical practices, and certainly just on a high level, for clinicians who are interested in having just a more holistic understanding of what's going on with their clients? One of my big takeaways from learning about the relationship between sleep and presenting issues that clients might be experiencing is that how people are sleeping or not sleeping really needs to be assessed as part of a clinical intake or an ongoing process in order to really understand what's going on with our clients, because many therapists, including me, will focus on a client's emotional history or presenting issues, but are not screening for the sleep disorders that could potentially be the actual smoking gun that is creating some of these symptoms. And again, I know that you do like huge, detailed, in-depth, hour-long trainings on these for clinicians, but at a high level, what are some of the assessments or screening protocols that you would recommend therapists begin incorporating into their assessment process, just to get some visibility into whether or not a sleep issue might be a more important thing to focus on first than spending a lot of time and energy unpacking their feelings about their parents' divorce? Not that that isn't also important, but that is not going to move the needle for a client if they have an untreated sleep disorder. And so I think there's like almost an ethical piece here that we need to know how to do, because if we don't, we're going to waste people's time and money trying to do things to help them that are ultimately not effective, because it's like shouting into a hurricane if they have a significant sleep disorder, right?
And that is a really spot on point, is trying to deal with whatever psychological manifestations or a person's dealing with, the neglect or the lack of understanding of at least addressing or acknowledging whether there is a sleep problem really can, in my opinion, and from what I've seen and read, save a lot of time as far as getting people to reduce their symptomatology. So as far as assessing sleep, there's multiple levels. In the research world versus the clinical world, there's different things. From a clinical standpoint, as a therapist, I recommend using, it's an 8-item, very easy scale. It's called the PROMIS, PROMIS, Sleep Disturbance Scale. 8 items. It's on a Likert form. And you don't even really need to score it. You can just look at it and eyeball, because it's very specific. It'll give you an idea if you're having trouble falling asleep, breathing issues, etc. So it can give the therapist a very quick idea, oh, there's something going on here. And then you could either probe on that a little bit more and try to find out, or just right then and there, go refer them out for a sleep study to see if there actually is an organic sleep disorder, such as sleep disordered breathing or limb movements, or if it is insomnia, or if it's psychologically driven, which in a lot of cases that's what it is. It's not an organic disease or a physical disease. It's a learned set of behaviors that perpetuates itself over time. And so in that case, having them see a behavioral sleep medicine specialist. These are almost always clinicians, psychologists who have been trained specifically in dealing with sleep issues, the behavioral component of sleep issues, and can treat that quite well and quite quickly.
And what I think is so fascinating, which had not occurred to me before we started talking, by the way, is that one of your recommendations is that a sleep study, a sleep evaluation, actually be part of preventative care, and that we need to have visibility into, okay, so you've determined that your client is having trouble sleeping, you think that it may be impacting the way they're thinking and the way they're feeling, but that they need to have a sleep study, because depending on what is really going on with that, it needs to be a specific and a different treatment depending on the nature of the origin. Because if we don't know that, the interventions that we attempt probably won't work. Can you say a little bit more about that?
It's sleep disordered breathing, the
Mhm.
umbrella. You have sleep apnea, snoring, central apneas that fall under that umbrella. But basically, it's you have a partial or a complete occlusion of the airway, and so the brain and body is not receiving a sufficient amount of oxygen. And obviously, that can cause some significant issues,
Yeah.
and it will force the brain to wake up. And so
Mm.
it will leave you or leave a person really deficient in getting good quality sleep, that deep sleep, or even REM sleep, because that's when the muscles are most relaxed in that deep
Mhm.
sleep. So it tends to occlude the airway even the most during that stage. And so you have cognitive issues as a resultant from that, not remembering things very well. Your metabolism will slow down if you don't do that, if you don't get
Right.
enough of that deep sleep, leading to more obesity, which can lead to more breathing issues. Those are treated very specifically. And luckily, there's a growing number of treatments. Automatically, people assume CPAP or continuous positive airway pressure, which is the mask that
Yeah.
goes over the nose or the mouth and forces air down. That is an option. It's been the longest available running option. Many people don't like it.
Mhm.
There's a lot of oral appliances through dental sleep medicine now that can be made specifically for you to move your jaw forward if you're snoring or if you have mild sleep apnea. Been very, very helpful for a lot of people. There's more things coming. There's more things being evaluated. There's a pill that's supposed to help stimulate the epiglottis to keep you from
Mm.
snoring. That device, the Inspire device that people insert, stimulates it to keep the airway patent. But that's obstructive sleep apnea. And if you have central, that's where the brain basically tells you to stop breathing.
My
That's not
goodness.
well, yeah, that's not well treated. That's really CPAP is about the only thing that can
Yeah.
help with that, and it's just a
Mhm.
symptom fix.
Yeah.
And then other physiological things like leg movements where people are kicking in the middle of the night that will disturb their sleep, give them fragmented sleep so they don't feel as refreshed the next day.
Mhm.
Narcolepsy, another neurological disorder. So there's those that are either neurological or more physiologically
Yeah.
based. And then insomnia or insomnia like disorders, which is, you know, I'm having difficulty falling asleep. I'm having
Right.
difficulty staying asleep, or I'm not getting a sufficient amount of sleep, even though I'm laying in bed for a good 8 hours.
Yeah.
And this is very psychologically perpetuated. It leads to
Mhm.
a lot of cognitive dysfunction in the sense that you start thinking very catastrophically about your sleep, what's needed, what you're not getting, how you're going to suffer, and you can see how the
Yeah.
hyperarousal, the anxiety shoots through the roof, and
Yeah.
that just perpetuates that poor sleep. And this really plagues that the poor sleep and this and the brain and the psychological hyperarousal plagues well over a third of our country, if not
Ugh,
more. And those are just some
absolutely.
of the numbers that have been like observed.
Yeah.
Personally, I think it's more, and people experience it randomly. Sometimes they'll have it for a couple weeks here, and then they go back to sleeping
Mhm.
fine, and then it comes back, and life happens. Life is a big ball of stress.
Mhm.
And so learning and being aware of what that stress is doing to you physically, psychologically, sleep wise, and then being able to take control of that, I think is one
Mhm.
of the biggest, strongest benefits that one can acquire, whether
Mhm.
it's through therapy or reading a book or
Mhm.
learning about this whole
Yeah.
area.
Well, but thank you for taking us into all of that, and I think what you were describing just highlights perfectly why it is so important to get a sleep study at the outset of this, because there's a big chunk of people who have the insomnia presentation who could likely be helped by things like cognitive behavioral therapy for insomnia, and we can use interventions, exercise, sleep hygiene, all of
Yes.
these things will probably help these people. But there's this other chunk of people, if there's a medical thing at the root of it, like if you have somebody with sleep apnea or some of the other medical conditions you've discussed, they could exercise all day long and still have the same issue. And so if you don't have visibility into it, it becomes very
Right.
difficult to be able to help them. And also, again, I love that you highlighted the potential impact on other things that psychologists like us might see. A number of years ago, I did actually have an experience that I will never forget, but that now every time I have somebody wander into my office saying, I have ADHD, or even in couples counseling, my husband has ADHD, and it is adult ADHD, and maybe there isn't a huge history of it, but it's something that they've been experiencing more intensely over the last few years. I now make it a point to ask about sleep, and I can't tell you how many sleep apnea cases I have uncovered. And so it is crucially important because, again, just think of the consequences of not doing this. We're talking about behavioral interventions and maybe getting on stimulant medication to treat these ADHD symptoms that are being caused by lack of oxygen to your brain, right? Like it's a whole big ball of yarn, and we just have to have clarity into what is going on. And thank you so much just for these recommendations. And so there was the assessment that gives you a high level what's going on, and I will certainly be linking to that tool in the article that will go along with this podcast on growingself.com. And then recommending a sleep study as just being part of it, like a little x-ray, a diagnostic thing. How would a clinician look for or begin to develop a relationship with a organization, medical office? Who does sleep studies, and how would a psychologist like me know who to refer to?
What a great question. So that varies by state, by locale, by insurance companies. So depending on for the patient themselves, what kind of insurance they have.
Yeah.
If everything needs to go through their primary care, then that would be their starting point.
Okay.
They would go to their primary care, and I always suggest trying to use certain buzzwords because a lot of them will say, let me give you a pill, or, and that's not what you want. That's not what the person wants. They're like, I've looked at my insurance. I need to have a referral from you to get a sleep study. I've been discussing with my therapist, and there might be some breathing issues, etc. Have them be a bit informed, right? Not blind when they go to see their primary care.
Well, and just a client has to go through their GP, and they show up, they're like, I haven't been sleeping well. And that GP wants to be like, great, let me write you a prescription for Ambien. Why is that a problem?
Because most of the time, so again, these medications are helpful for short term when life events take place, when there's something either traumatic, you lost a spouse, or you lost a good friend,
totally.
you're stressed. We understandably would expect for you to have some disruption sleeping, right? Your mind just doesn't want to shut down. And so in that case, those medications may be helpful for short term so that you can get sleep, right?
Yeah.
Medicated sleep is better than no sleep,
Got it.
but it's not good for long term. Unfortunately, when a person tends to go off of them, the sleep that they went on for them in the first place is worse. And now they think, oh, I need this. I have to have it. So it becomes a reliance, a crutch, like an addiction, pretty much, instead of dealing with the root cause of the problem. And again, if someone has sleep apnea, Ambien is not going to fix
Not
anything.
going to help.
It's not
Okay,
going to fix
so
the breathing.
we need to be empowering our clients to advocate for themselves and to go in and talk to a medical professional, and maybe a little pushback. No, really, I want a sleep study. I don't just want a pill. Yeah, got it.
Exactly.
Okay.
Exactly. And just, again, the buzzwords are, my partner says I snore, or I'm falling asleep while driving. Those things that really should be a red flag for the clinician or the GP to say, okay, this is a sleep study. Then the insurance will come into play, whether they're going to do a home sleep study, the type of home sleep study, some are better than others, or do an in-lab sleep study. So there's a lot of variables that come into play there.
Okay, got it. Okay, so
and
then
you collaborating and having the referring physician or the sleep physician contacting you, and you being the receiving end of the information, of the data.
Got
helps
it.
that connection so that you can work with them.
Okay, so be like requesting ROIs so that you can be collaborating with other professionals. And then depending on the outcome of that study, there may be medical treatment potentially that you can know about and support your client with. But then I think I also heard you say that cognitive behavioral therapy for insomnia can be very helpful for some clients depending on the origin of this. But I've also heard you talk about needing to make a referral to a psychologist who's really a sleep specialist. And so, where would you draw the line between things that a general practitioner therapist who is reasonably informed about protocols for supporting clients with sleep, perhaps attending some of your continuing education and trainings for therapists to develop some competencies in these areas, versus a time when a therapist can be like, you know what, I think that this person probably needs maybe not a higher level of care, but a more specialized protocol than what I can provide as a general practitioner.
Yeah, and that's going to be personal dependent. So many therapists who are general practitioners, general LCSWs, um, PhDs can go get certification and certified in cognitive behavioral treatment for insomnia and be a little extra
Yeah.
option for them so they can be the ones to integrate it in with their own practice. And then there are some who that's all they do is
Yeah.
dealing with sleep because so many people have sleep problems. Um,
Absolutely.
so it's there is a spectrum, right? So you can learn how to deal with it, but there are certain protocols that are followed consistently within that kind of community. And there are some questionnaires that can be given to address or identify the severity of one's insomnia if it's there and talk about it. And you can make some suggestions, refer them to read a book that's been written by a sleep clinician, or just play it safe and just say, I'm just going to refer you out
Yeah.
because my expertise is not in this area and I don't have the bandwidth to maybe get certification, and just have people in your area that you can refer to.
Yeah.
And again, that's that bi-directional communication with local providers. Those can have them see you if they can't manage the psychopathology or other issues that they're going through, and vice versa.
Yeah, definitely. That's fantastic advice. And so what I'm hearing is, and even just from talking to you, is that this is a common issue that many of our clients are grappling with. And so it's something that we need to have on our radar because it can impact many things that show up as clinical presentations. But there is a lot here that a competent provider needs to know about and be knowledgeable in. And so that if you would like to develop competencies to help clients at least do basic things, to find a program that can help you become certified as a cognitive behavioral therapy for insomnia provider. And I'd love to get your recommendations about how to find a good program. But also, I think I'm hearing that perhaps part of the assessment process is that if you do what you know how to do in terms of those cognitive behavioral interventions with a client, and perhaps that client is not responding pretty easily to some low-hanging fruit type stuff, that would actually be an assessment in itself, or perhaps the severity of the insomnia, the duration of it, and if the things that you know how to do aren't working fairly expediently, that we need to be making ethical decisions as responsible providers to say, let's get you connected to an expert who really knows this
Yes.
stuff in, out, and
Yeah.
sideways. Is
And
that the right way of saying it?
yeah, and
Yeah.
like the perfect example is you have a primary care physician, right? They know a little about a lot.
You have to.
They
Yeah.
don't know a lot about a little, and
Right.
because it's not taught in any really substantial form, sleep is just not talked about in medical school or in nursing
Totally.
school
Or counseling
to any
school.
degree or any school. And so if someone comes in and says, I'm not sleeping well, the paradigm or the algorithm in one's brain is they're depressed, they're sad, they need a pill, versus we haven't the information or the knowledge that, hey, I personally don't know enough. My automatic response should be, let me find an expert. If
Right.
someone says they're having kidney issues, the doctor is going to refer you to a kidney specialist, right?
Right.
They're going to refer you to a specialist because they don't have that. That has not, for some reason, expanded and extended into sleep medicine.
Or
template
therapy for that
or
matter in
therapy, right?
general. Yeah, exactly. And I think that just as a general trend in our profession, like one of the things that I am routinely concerned about is providers who we have to have so many different things on our radars, right? And to a degree, you do have to be a generalist because there's all kinds of stuff
Sure.
that can come in. But I think that particularly with therapists, it is very easy for people with good intentions start practicing outside the scope of their competence because they don't know what they don't know. And it's so hard to get visibility into what that is. But sleep disorders, like couples therapy, are one of the things for sure. And so this is so much good information. And I would love it if you could talk a little bit more about how a conscientious therapist who is interested in learning more, first of all, perhaps become more educated in cognitive behavioral therapy for insomnia. Are there training programs or learning experiences that you know of that you found to be evidence-based, reputable? Where would you go?
Yeah, so there's actually a handful of universities. Stanford University has one. I believe UCLA has one. University of Arizona has one.
Mhm.
University of Pennsylvania. I believe Harvard has one.
And now, are
That
these like degree programs, or can you do
they're
8-week
certified. No,
certifications?
and
Okay.
a lot of them are like remote
Hmm.
online for like an entire weekend,
Great.
all weekend, right? So it's an intensive 2.5, 3 day program
Hmm.
in which they go through everything. You have to have some licensure
Yeah.
to be able to deliver it, is because
Super.
it's a clinical intervention. And so the prices vary. I don't think they're terribly that expensive. There's also others where you can just learn about the concept or the ideas behind CBTI, which would not be a certification program. That
Hmm.
way you can just learn about it and say, hey, maybe this is something I'd like to
Yeah.
incorporate into my practice. But at least, like you were saying, be cognizant
Hmm.
of this area, this option for treatment,
Hmm.
rather than I don't know what to do with you,
Right.
or let me, there's going
Exactly.
to give you some medications or whatnot.
Sure. And now, and some of these, perhaps not a certification, but just continuing education, learning more, you do that with your group.
Yes, I do continuing education seminars through Institute for Brain Potential,
Hmm.
and I go all over the country, and all my talks are about sleep. Some are already recorded. The one that I do live is sleep anxiety in the brain.
Oh,
It's quite
interesting.
relevant and a lot of fun to do, but it gives me as a non-clinician, which is
Hmm.
I always wanted to help and disseminate information, so I get to disseminate at a very ground level, grassroots kind of level, the people on the front line, tell them, show them, give them data about
Hmm.
how important sleep is, its relationship to so many different things, whether it's psychological, physiological, health wise.
Hmm.
And then do what I'm doing here, which is it's important to assess sleep and put it in your practice.
Yeah.
One short little questionnaire can help someone tremendously.
Yeah, it can be transformational. Okay, and we'll be sure to include a link to
Sure.
your training programs for the post for this as well. And then very lastly, before I let you go, any recommendations for how a therapist might find a psychologist who specializes in sleep science locally that they just can reach out to, network with, begin to develop a relationship with? Where would you find someone who really does possess the education, expertise, competencies?
So the Society for Behavioral Sleep Medicine, I believe it is. They are an organization, and on their website, and it'll give you a list of all of the what we call the diplomats of behavioral sleep medicine. And these are all clinicians who have gone through the training program, been certified in CBTI
Perfect.
and
Okay,
behavioral
that's
sleep medicine.
wonderful. Because I think it can be challenging. I mean, I know therapists even who like start messing around on psychology today, and it's so easy, I think, for people to just list something in a bio. But especially for this, we're looking for someone who specializes in it and who
Yes.
truly is a subject matter expert who can be a competent referral partner for
Yes.
us.
Yes.
Okay, so thank you so much. So, Dr. Michelle Okun, this has been so lovely. Are there any parting thoughts or anything else you would like to share with our therapist friends listening to this before we wrap up here?
I think the appreciation that sleep and the behavior of sleep is as critical as getting nutritious food and consuming water. It is,
Yeah.
we need it to sustain and maintain health.
Hmm.
And that the mindset that especially Americans have, that I'll sleep when I'm dead, or I'll sleep later. I got all these other things to do and I'll just sleep whenever I have a chance. You will, it's a disservice to yourself,
Hmm.
and it will make everything harder, take longer, more difficult to get done. And when you
Hmm.
are well rested, you are the conqueror of your world, right? You can take on anything.
Yeah.
And as a healthcare clinician, therapist,
Hmm.
when you're well rested, you can manage and handle your clients'
Oh,
issues,
wait, this
problems
extends to
so much
us
better.
too.
Yes, yes.
Good reminder.
And so focusing on yourself, practice what you preach. And people always ask
Noted.
me, they're like, do you sleep well? And I'm like, I make sure I sleep well. I focus on my sleep.
Hmm.
And if, like right now, I said I'm not getting the best sleep for whatever reason, I don't know if it's just hormones, but I'm working on it and I'm focusing on it. I'm not
Yeah.
just letting it kind of slip by the
Yeah.
wayside.
Thank you so much for bringing that up. And what a lovely note to end on, is because I think especially therapists can be so other focused when we're thinking about, okay, how do I assess my client's sleep and make sure that that foundation is solid, so then we can figure out if it's
Yes.
maybe contributing to their psychological symptoms. And but I think it can be hard for us to turn that mirror back on ourselves and thinking about,
Yeah.
oh, am I sleeping? And how is that
Right.
impacting my ability to function and be in a good place personally as well as
Exactly.
professionally? Thank you for the reminder. That's really
You're
important.
very welcome. In my seminars, I get people that a very big proportion will come up to me at some point and they're like, I saw the title and I don't even need CEUs, but I came here because of me.
Mm.
Right. So a lot of people come for self serving reasons, and then it also helps them for CEs. But it is a big issue that doesn't really get talked enough. And when the news or the media gets a hold of it, it's a blurb. Like it's just
Mm.
a blip on a screen, and you don't get, and they all they're going to do is give you that sleep hygiene,
Yeah.
right? Don't have too much caffeine. It's like people are like, when I see them when they come to me for the workshop for the CBTI, and I talk about that, I'm like, you've been there. You wouldn't be here if it worked for you,
Hmm.
right? So it's a kind of, I've been there, done that. Don't tell me that's not going to work, and I know that's not going to work. We know it doesn't work.
Yeah, but I could see how that must be so like frustrating, but also like this, I could see it turning into a passion for you personally, because
It
this
is.
is such a large topic. There's so much information. There are so many different variables to consider. And so for you as a professional to see this advice being sent out to everybody, stop drinking as much caffeine, get more exercise, and that blanket solution should work for everyone, must make your head want to explode.
It does, and it's I always get that when these talks or whomever I talk to get to dispel the myths that those
Hmm.
are myths. I mean, don't get me wrong. Too much caffeine, not enough exercise, all those things are not helpful or healthful for you. But we are in a mindset of quick fixes,
You're
right?
right.
Everyone wants something immediate, and that's why pills are sought out and sought
Hmm.
after, not only from the clinician because they only have so much time to spend with the person, but also from the person's perspective. Just give me something that's going to fix me,
Yeah, knock it
and
out.
nothing fixes the CBTI, that protocol, that those interventions. They actually fix the problem, and then they give people like a support base for when life is going to come at them again,
Mm-hmm.
because it
Oh,
does.
it
Life comes at
absolutely
you
does.
every time.
Well, and we need to develop skills in order to manage this crucial part of our fundamental wellness that we are not taught.
No, we are not. No, and if you're lucky that you run into someone or you happen
Hmm.
to take an interest in it, or it is not a specific protocol that gets introduced in schools to focus on it. Yeah, it's really sad.
Well, thank you so much for your work in trying to change this major problem that we're facing as a society.
Yeah,
Seriously.
yeah,
Yeah.
yeah, definitely. And I'm so glad that you asked me to do this, and I'm so glad that this is part of your whole kind of wellness package thing,
Mm.
because It is really important, and most people forget about it.
Oh, well, thank you for being here and doing this with me because this is a labor of love for me. I'm always concerned because like there's a lot of information out there, but a lot of information accessible to the public is not high quality information, and it can be very difficult for people to access services and educate themselves and become informed. And so I think it's just part of my personal mission to be putting high quality information out into the world, both for the general public, but also for therapists in order to try to improve the system to the degree that I'm able. So that's what
Well,
I'm
yeah,
up
I
to.
mean, you guys don't have exactly tons of extra time to be reading research papers, and you need
Yeah.
things summed up and kind of paraphrased for you as well because of your
Hmm.
time constraints. So,
The struggle is real. Thank you again, Dr. Michelle. This was phenomenal. This was such a joy. Thank you so much for coming and sharing your wisdom with our therapist community.
my
And you
pleasure.
guys, Dr. Michelle, you shared so many links. Again, we'll link to all of them so that people can find you and learn more about your training opportunities and your practice. And if they're in Colorado, potentially refer some insomnia or clients or people who are
Yes,
struggling with more severe issues to you.
absolutely.
Yay.
Absolutely.
Well, thank you again.
You are very welcome. It was my pleasure.